So what are the key symptoms and early indicators of stroke? Recognizing the early symptoms of stroke is crucial for timely medical intervention. The acronym FAST is going to help a common man in identifying a patient with stroke. What does FAST stands for? F stands for face drooping. One side of the face may droop or feel numb. Ask the person to smile, and if the smile is uneven or one doesn't even smile or is not able to move one half of the face, it could indicate a stroke. A stands for arm weakness. Sudden weakness of one side of the arm or leg, the patient is not able to lift his hand or leg, could indicate a stroke. S stands for speech. Speech difficulty. The patient will not be able to express or speak, or the speech will be slurred. This is also an indication of stroke. And T means time to call emergency services. As soon as you recognize these symptoms, it is extremely important you call the emergency services and take the patient to a nearby stroke center or any hospital which is nearby. Other key symptoms and early indicators could include sudden confusion, sudden numbness or weakness, sudden vision issues, severe headache, dizziness or loss of balance. One should also be aware of transient ischemic attack, TIA, which is also called as mini stroke. As I mentioned, the symptoms which are above mentioned symptoms such as facial weakness, speech difficulty, weakness of limbs, this could appear and be cured within a short duration of time. This means it is a mini stroke and it is a harbinger for a major stroke to happen. So in these situations also, patient has to be taken to the nearby hospital as early as possible. So what can a common man do when he comes across a patient with stroke? So first thing to do is call the emergency services as early as possible. Book for an ambulance, or if you can take him by your own vehicle, please do that. Please note the time of onset. It is important to note when the symptoms first started, because there are certain treatments like clot breaking mechanisms such as thrombolytic treatments which can be effective in reversing the stroke if given within the 4.5 hours of stroke time onset. Keep the person safe and calm. Stay calm and keep the person calm as well. Check breathing and pulse. It is extremely important you check the breathing and pulse, and if required, if the patient is not breathing, if the pulse is not there, you can do the emergency CPR services. Avoid giving any food or drink because there is always a risk of aspiration and the food and drink going into the lungs. Stay alert for any worsening of symptoms and follow the emergency protocol instructions. So as early you get the patient to the hospital, the chances of recovery from the stroke are good. So there are two important types of treatment in a patient with acute stroke. One is clot breaking mechanism where injections are given to break the clot. The other one is through the operation which is called as mechanical thrombectomy, which is useful if the patient is brought within the first 6 hours of stroke. Thank you.